ADPC. And this is a reschedule from last week where we had spring break. So thank you again just for everyone's flexibility. We have so much to do this year that we're really grateful we're able to still meet in this month. So thank you so much. We are going to have our normal director updates from Annalise. And then we're going to spend some time going over our scope and bylaws. We hope to have some time to do a naloxone preview led by Mara, and then we'll have public comment. So that's our scope for today. And I will hand it over to Ashley. Ashley, we introduced you. Did we introduce you? Yes. Okay.
Yes, yes,
Sorry.
it's
Thank you for,
okay.
would you mind doing a roll call, please?
Not a problem. I'm
Thank
going to
you.
call everybody by their first name. We'll run through this really quick. Stacy, you are here. Dharma, Blue,
Here, good morning.
good morning. Mariah, Mariah here. What I saw.
I'm here. Sorry, I couldn't find the button.
That's okay. Janine,
Present.
Eric, right. Naomi, looks like she's coming late, so we'll move on to Jenna.
Oh, I'm here.
Oh, you're here? Oh, hi. Sorry about that.
Hi.
All right. Jenna,
Also here, yeah.
okay. Adam,
Here.
Scott,
Here, present.
Claudia, Amy, Serafina,
Here, good morning.
morning. Crescentia, did I say that correct? Crescencia? I don't think she's here. Okay, great. Thank you.
Is that it? Okay, great.
Yes, we're good to move on.
Awesome. Great. Okay. Can I hand it over to you, Annalise, for director updates, and then you can just kind of transition into the scope presentation?
Awesome. Thanks, Stacy. Hi, everyone. I think I know most people. Annalise Dolph, the director of the Alcohol and Drug Policy Commission. As Stacy said, we start every meeting with just a few directors updates so folks know what's happening with the rest of the ADPC. You guys are the very last committee meeting this month. So it'll be interesting to see if you all change to this permanently. Normally you'll be the same week as another committee, but kind of fun to wrap up with you all. So full commission met last month at the beginning, well, this month, sorry, at the beginning of March, and mainly heard from OHA about the Rural Health Transformation Program and grants. So it was very helpful to get an update on that. This month, we are meeting next Monday, and we will have the first quarterly update of the 5-year comprehensive plan, which is super exciting. It's the first quarter, but there's still a tremendous amount that is already moving forward. So we're excited to give that to the full commission. And we can share that out to all the committees as well. So you all see kind of how your work fits in with all the others. We're also going to have an update next week at the full commission meeting about some school substance use disorder intervention pilots that we've leveraged some funding through OHA to get started. That was a priority of the OEAC committee. The recovery committee met this month and next month as well. They will be continuing to focus on recovery community centers. They're putting together a definition of, we don't have one in the state. So they're recommending a definition of recovery community centers and starting to look at how current RCCs are funded. Treatment meets next week, and they will be beginning their focus on withdrawal management and access to withdrawal management across the state. And Kat Livingston from HealthShare will be there presenting about HealthShare's approach to assisting members with high acuity substance use disorders and recent IET metric findings by setting. So that might be interesting to folks in this committee as well. Prevention, the Primary Prevention Committee is really focused on House Bill 3321 was a 2025 bill. It's actually going to be an example later in our presentation. That is really doing a great analysis of primary prevention throughout the state, upstream prevention. So that's going to be really helpful for all of us to have. And they are starting to scope the concept that they included in the comprehensive plan of a center of excellence, named to be TBD there, I will say. So if you feel judgment when you hear center of excellence, maybe let's just hold off and see what they come up with. And I think that, the only other thing I was going to add, the Opioid Settlement Board meets tomorrow we have about $10 million left to allocate for this biennium. They allocated to Save Lives Oregon, of course, the 30% for the tribes. And folks might remember I shared previously some funding to decrease the gaps for the burn funding. So there's about 10 million left. I will find out tomorrow, but I think the board is really leaning towards kind of a broad RFP process for those funds, which will be one time. So full disclosure there, but just so everyone knows, we'll have a public comment period tomorrow before we move into our discussion. So I can put the information for that in the chat if folks would like to show up and have any public comment to offer. So those are all my updates. That might have been a little bit longer today. Always happy to answer any questions.
Thank you. Questions? Let me look at the chat. I'm not sure if we had anything in there. Okay, no questions. I will say I've had the pleasure of working on the high risk work with Kat, and it is a really fantastic presentation. So I think people will find it to be interesting if they want to pop in and listen. All right, Annalise, it's still you. Scope presentation.
Awesome. Have Ashley pull that up. While Ashley's pulling that up, I'll just preface this by saying, I think we've talked about this a little bit before in this committee. We decided going into this year with all the committees, everyone's taking a look at their charter, as you all are doing today. We also had our contractor, Tim Rourke. Yes, I will put that link in for opioid settlement. We had Tim go ahead and pull together some slides for us that kind of delineated what our role is in state government with relation to advocacy. And so wanted to share that with this group, as we've shared with others, as you think about kind of the words you use in your charter and what you are charged with doing, how that fits with our role as this executive branch agency versus being like grassroots advocacy. Next slide. Here's today, everybody. So advocacy refers to a wide range of activities that can influence public policy, not necessarily just one thing. Next slide. There's different types of advocacy, and it's important to talk about this because some of these things we are very free to do, and then other things we are not so free to do. This is also helpful for those of you, I was going to name check Haven here, but I know she's not here today. Can probably speak to this from the nonprofit perspective. There's certain rules if you work for a 501c3 about how much time you can spend. So we're really talking here about public education. So, raising awareness with the public, that could include policymakers. Then there's grassroots organizing. That's really like Oregon Recovers is a good example in our state of doing grassroots organizing. Then there's coalition building, bringing together organizations kind of on common issues, but not necessarily kind of pushing advocacy through that. Next slide. There's nonpartisan voter engagement, like hosting a town hall or community conversation. Litigation, of course, is a form of advocacy. And then there's direct lobbying, when you go to the legislature and you have to check that little box that says you support or oppose something. So those are really all types of advocacy. Next slide. So as I alluded to, all advocacy is really not the same under regulations and certainly as we exist in the executive branch. Next slide. And I know these are very simplistic and we're kind of going a little slow, but they're really meant to be kind of a resource for folks going forward. So ADPC is an executive branch governmental entity. We're not an advocacy organization. We're not a 501c3. That means that all of the, if we ever take a position on legislation or advocate for funding or anything like that, it all has to be approved through the governor's office. Next slide. So public education is squarely within the role of the ADPC and this committee. Grassroots organizing, not so much. Coalition building, so perfectly appropriate for us to have organizations come with common interests, come and report to us on what they're doing. That is totally fine. We can't do nonpartisan voter engagement. We obviously can't do litigation or direct lobbying. Next slide. So as we said, we can do public awareness. So publishing issue briefs, reports, making recommendations, community engagement efforts to inform community leaders about important issues and solutions that can include policy change squarely within our role. Next slide. Yes. Okay. So now we're getting a little bit more into the specifics. So, as I said, as an executive branch agency, we can only support or oppose a specific piece of legislation with permission of the governor's office. And, it's kind of rare, particularly to oppose legislation through the governor's office because they're really looking at it through a political lens, looking at it through how it relates to everything else they do across all state agencies. So sometimes there might be something that, we don't think is the best policy, but another agency does. So those are all kind of the ways the governor balances it. Also that there's 3 branches of government, right? And so the governor does not weigh in on everything, I think, as folks have seen. Sometimes things just need to play out before they come to the governor, and then the governor has the right to sign something or not. That said, so we're always going to respond to legislator questions. And I think actually, Mara, I don't want to I'm not going to steal Mara's thunder on this, but I think in the coming months, you're going to have legislators coming to you actually to gain input ahead of time as they draft policy on issues in your space. That is exactly what this committee is for. Folks who've been with us from the beginning, that's kind of always been my dream for this committee in particular, that if we begin to regulate some things in the harm reduction space at any point, which I think we all know there's a lot of risk to that right now, but if we do, I think it's exactly this committee who should be making those recommendations. So providing data, we often provide data around substance use disorder and research. We're sometimes asked by legislators to maybe weigh in on the effectiveness of something or provide background on it. That is squarely within our role. The ADPC also by statute, we are charged with making budget policy recommendations. That one's a little, we're going to have a big opportunity with our financial analysis that we're working on to make some recommendations to the governor about, where funding should be allocated. But that said, because we're an executive branch agency, whatever goes in the governor's requested budget is what we are tied to. So whereas folks who are in the community, you all can approach the legislature and advocate for funding for everything that is important to you. But we have to stick within the bounds of the governor's recommended budget. Next slide. I think we're almost done here. So again, getting the explicit support of the governor is required to support or oppose anything. As you can imagine, there's a form that we fill out and have discussions in order to do that. Next slide. But you all, of course, this does not bind you in any way, shape, or form as to what you can do on your own behalf. You, of course, have to work with your own organization. Many of you are in government. You work for nonprofits. You will have your own regulations to follow. People were asked a lot by committee members and commissioners, can I say that I am a member of this committee? Can I say that I'm a commissioner? Absolutely. Just be clear to say this is not a position of the Alcohol and Drug Policy Commission. That's all that we ask. And that's really, I think about it. And I think there might be one more slide. The example, great. This is a great example. I mentioned House Bill 3321 actually earlier, that the Primary Prevention Committee is informing this analysis for primary prevention. This actually didn't come from the ADPC. It did come from some of the folks who were involved in advocating for this do sit on the prevention committee and on the ADPC, but they were not doing this work in the name of the ADPC. And they lobbied for passage of this bill that provides a definition for primary prevention and allocated some one-time funding for us to do this assessment of primary prevention throughout the state and an analysis of funding with some recommendations, and that's ongoing. So during the process, the ADPC was asked, would this be a benefit? How would you do this if we passed this? So, we can respond to those questions. To be clear, we weren't advocating, but we were answering questions. And then, and as it says, like, members of the committee testified in support of the legislation, but in their own capacity as prevention professionals, and they didn't represent the ADPC. So, we did not get permission to support this. We didn't support it. We didn't oppose it. We just answered questions, and that passed. And now we are implementing that work is what we do. So that's kind of a good example of how it can work, and how you all should not feel like being on the ADPC means you can't advocate for what you believe in, because that is certainly not the case, but where kind of the line is. So hopefully that's helpful. Do folks have any questions? But maybe some uncertainty. And whenever we have conversations a lot, I will say, during legislative session, especially with committee members and commissioners. And I, always let Mara know, right? If there is something that you're like, hey, I just want to let you know, there's this bill. We had conversations with some of you last session when the syringe service program bill was first introduced. And I know members of this committee advocated on that bill. It's good for us to know, so that if we hear from folks who, for instance, at coalition building, if we hear from one of you who's like, hey, do you know if anybody's like organizing around this, we can point you to them without participating in the advocacy ourselves.
Thank you, Annalise.
Yeah.
I find this review to be super helpful, and especially at the beginning of the year when we're just kind of getting started again, and we have some new people as well. If there's questions, again, you can always reach out to Mara or to Annalise or to me, but they would be better if you have concerns or questions about a specific issue or showing up in a different setting. So that's great. Thank you very much. Are there any other questions or concerns related to scope or advocacy? If you have a question, likely others do as well, so feel free to ask. Okay, these slides obviously go out, but this link it will be in the slides when they do go out if you want to take a little bit of a deeper look. Okay, great. If there's no other questions, thank you very much. And Mara, I'll hand it over to you to talk a little bit more about the bylaw recommendations.
Yes, absolutely. Thank you so much. So it's about that time I said in our last meeting for us to go through our bylaws and just clean them up a little bit. So um, we had um, we had gone through and um, and changed our name with our new name. So this bylaws, actually, if you could click on that link in there, the bylaws with proposed changes. Yeah, it will show, yes, in theory, all of the things that I have taken out and put in. So these are the recommendations. The way that this process worked was last time we had chatted about folks who might be interested in participating in like an ad hoc subcommittee, a work group where we just had gone through um, some of these suggestions. And a group of us did go through some of these suggestions, and this is sort of what we came up with. So these are recommendations. We are definitely open to the availability of changing things further. But I want to bring your attention to just a couple of specific things. So you'll see a lot of red. Just notice that a lot of that is changing the name. I just wanted you to see the process of changing the name from harm reduction to health and safety interventions. We didn't eliminate the words harm reduction from this entirely, but we sort of, wordsmithed a little bit just to make it clear that this is the name of our committee and this is the work that we do. In this first big crossed out section, um, we had a link to the Department of Health and Human Services overdose prevention strategies specified for harm reduction. I will let you know that that link is still an active link, but almost every other link from that page is no longer active. And so we felt that it was just easier to get rid of that entire paragraph rather than go searching for a new thing to link to when this segment is just about defining what it is we're doing. We're our scope. Um, so I figure I will just go over these things as we move through this, and if anyone has any questions, please feel free to put them in the chat, stop me, and I'll pause every so often and see how we feel. Is that okay? Cool. I'm seeing nods. Awesome.
I'll be looking at the chat too, Mara, if that's helpful.
Thank you, Stacy. The next segment that is not a name change comes from, so we're still defining our committee scope of practice, and we're still aligning with the National Harm Reduction Coalition. And after our conversation with Annalise that she just shared, we felt that mentioning movement for social justice like didn't really fully specify like fall within our scope, as we mentioned, because of the types of advocacy that we are and are not able to partake in. So just taking out that sentence, still keeping the definitions the way that it has been, just taking out the social justice, because I feel like there's been a little bit of confusion about what our scope is and like what we're able to do in terms of legislature. We are an executive branch agency, so that is the suggestion there. If you would scroll down just a little bit. Yep, here I just added /risk reduction. I did that for most of the things in spaces where it said harm reduction. Keep going. Yes. Okay, so now we get into membership. So we didn't change anything about who can be in the membership. We didn't change anything about the committee terms. Still 2 terms, no term limits. Yes, keep going. Go down to the attendance expectations. Yes, there we go. Okay, so this was something that was put into both the commission bylaws as a whole and some of the other committees. This was just I took this language directly from the prevention committee's bylaws that what this says is that we expect that you participate, you show up and you participate. Committee members will strive to attend all regular monthly meetings unless excused by staff and or chair. Basically, if you're not going to be able to make it, and most of you are absolutely fantastic about this, just shoot me an email or Stacy an email that says like, "Hey, I'm not able to make it this month," and we'll send you the notes and you know where to find the recordings, etc., just to be able to keep up with the work. Um, and there is in here, this hasn't happened, but we just want to make sure that it's in writing, which is failure to attend and communicate over an extended period of time, i.e., 2 or more meetings, will result in removal deliberations set out in a specific section of the actual commission bylaws, which basically says, and I have this in the PowerPoint as well, but I have it as referenced at the bottom, which is a committee lead may recommend removal to the commission chair and director for non-adherence of bylaws. So if someone is not here for 2 or more meetings and we don't hear from them, then what Stacy will do is say like, hey, you haven't participated in 2 or more meetings. We would love active participation, so we're going to hopefully open up this voting member slot for someone who is able to participate. And that doesn't mean you can't come to the meetings. It doesn't mean you can't be a voting member in the future. It just means that like right now we're hoping that someone who has more availability to be a voting member will be put into that slot.
Can I
Uh,
just jump in for 1 second, Mara? Just to, I guess, add that it's not a punitive issue or approach at all, but just to keep us as engaged as possible, and also just to give folks the freedom and the ability to say, "I don't have time right now." We totally understand, and respect and appreciate that as well. So just I wanted to add that piece. Thanks, Mara.
Yeah, thank you, Stacy. That's really helpful. Yeah, this puts us in alignment with the commission as a whole and um, some of the other committees. So that is helpful as well. Um, I think there's just like 1 or 2 more things in here. Oh, this is an exciting thing. Well, I think it's exciting. I had a fun time doing this. I hope that you think that's okay. The committee will elect a non-ADPC commissioner co-chair. So this has existed in a couple of the other committees as well. I think prevention is working on a co-chair and treatment has co-chairs. And they have had a lot of success with that. And in talking to Stacy, she said that she would be really open to this. So the co-chair will step in if Stacy's unable to join us. The co-chair will participate in our behind the scenes conversations in prepping for these meetings, and really just be an assist to the staff and to our chair, Stacy, right now. So, if you would like to put yourself up for co-chair, or if you would like to nominate someone, please let me know. And we will get that process rolling if these bylaws are accepted at the end. Okay, keep going. There is one thing here, just because I got a little bit flustered at one point that we had an abstention. I looked into what happens if someone abstains with fist of 5 voting, and there's all sorts of people just make their own decisions. So what I've put in here is abstentions are allowed so long as quorum is reached. So as long as we still have quorum, if you would like to abstain from a FISTA 5 vote, then that is totally acceptable. And I just wanted that in writing so that things didn't get crazy like they did that one time we had abstentions. And I believe that is everything. I know that is a lot, and this document is covered in red. But does anyone have any questions? Does anyone have any comments, any concerns before do we want to have a discussion? Or if someone wants to bring a vote, you just let me know. Blue.
Yep. Thanks, Mari. Oh, Blue, go ahead.
I know I saw something about a term for maybe it was the chair. Are there terms for the general members? Or is it
Yes.
just, okay, did I miss that? Sorry.
Yeah, so that one that hasn't been changed. That at the beginning is they're 2-year terms and there's no term limits. So
Okay.
after 2 years of being on the committee, if you want to step off, that's great. If you don't, then we're just assuming that you're continuing your term. Perfect. Amazing. Ashley, can you get rid of this screen share? Thank you. I would love to see people's faces.
Any other questions or concerns? The request was made to have the document be a little bit bigger as we are talking. So does anyone need to go back to the beginning to see it in any other kind of larger? Oh, yeah, Serafina, go ahead.
Yeah, I would just love it if we could review one more time the areas where we had put in the risk reduction instead and just kind of briefly see if that's exactly what we want to put in instead of potentially health and safety intervention.
Yes.
Would you like me to pull up the screen again?
Yes. So the first is on page 1, under segment 2, overview and function, is where we put in risk reduction. Oops, go back up a little bit. Right there. Assure committee membership reflects a full range of sector partners engaged in harm/risk reduction strategies, interventions, and policy development. That is the first. The second would be on page 2, under membership. Engaged in input from the committee members towards the goal of achieving equitable representation across the diversity of sectors, groups, and individuals engaged in harm/risk reduction strategies, intervention, and policy work in Oregon. And those are the 2 spaces that instead of taking out harm reduction entirely and making it our proper noun, capital H, health and safety interventions name, I kept it as the descriptor and put it as harm/risk reduction. Blue.
Can you just go up to the first page? I know you said you took out the HHS link or page, and I don't think I was able to clearly see like what.
Yeah, keep going. There you go, that big ol'
Yeah, so
section.
okay, I see. So you took that all out, but it still says that it aligns with the National Harm Reduction Coalition.
Yeah.
Okay.
Yeah.
Okay. Thank you.
Yeah. that paragraph was like it described the like HHS overdose prevention strategy, and then yeah, like I said, that link it does go somewhere, but everything from that page doesn't go anywhere anymore. Jude.
Hi there. So I understand the concern about the social justice sentence. I did want to share just a little bit about how social justice could be legitimately operationalized in this context. Having thought and looked at this a lot in the past, is looking at, embedding equity and how we're making decisions, how we're allocating resources. And I'm saying all these things because I know that I'm watching the ADPC legitimately operationalize social justice. And I think these are the kinds of things that the Harm Reduction Coalition was calling out, making sure you're allocating resources to people, that you are requiring culturally and linguistically appropriate services and materials, and using low barrier access and involving people with lived experience. All of those things are social justice. So that's kind of, when you think about the social justice underpinning of all the Harm Reduction Coalition. So it'll link back to that. But I do think being overtly accountable for those kinds of things and having measures of those is really important, particularly um, uh, as the name is changed to something that isn't necessarily going to be recognized as harm reduction.
Thanks for that, Jude.
And then there's a comment in the chat from Anne, and that sentence highlights respect for people. PDUW. It's too early in the morning. PWUD. So important to keep it in. People with use disorder. Any other thoughts on the specific portion of the? Yep, go ahead, Seraphina.
Okay, so I'm happy with, I think, the risk reduction. After reading it again, I think it makes sense. I do feel like Jude brings up a good point as far as the social justice piece. So I just want to bring to the table whether or not we want to look at that last line and a way of making it make sense to keep it in there.
Annalise.
I don't know if you have some specific language there, Serafina, and I very much appreciate our agency partners backing up the use of that term. I will just say that the ADPC does not have the, how do I say it? Large insulation that OHA has with words. So sometimes I feel like we maybe need to be a little bit more careful with our words than maybe our partners at OHA may. So I wonder if folks want to consider that sentence, if maybe we could use a different term than social justice and instead focus on what I'm hearing is maybe the more important thing, to say that this group really centers respect for the rights of people who use drugs, or respect, or centers the experience of people who use drugs, or something like that.
So potentially be explicitly saying that, taking the word social justice out and explicitly saying centers around. You said it very nicely, but I think your point is just to be really clear and pointed rather than to use that term.
And I think if you take a look at the next paragraph, it does say that. So if we take out the social justice word, the next paragraph then reads, the policies, strategies, and interventions and practices supported by the ADPC, Health and Safety Interventions Committee, will center people with lived and living experience of substance use, especially those from marginalized communities. Lastly, the strategies, practices, and interventions supported will meet and engage people who are using substances where they are, without judgment, stigma, racism, or discrimination. And I think that encapsulates it pretty well. We also have a link to the NHRC, the National Harm Reduction Coalition, and on their page, it lays out all of these things. So I wonder if that fits with the conversation that we just had.
Yeah, that's helpful to remind us to just kind of maybe take a step back and look at both of those sentences. So what was taken out and then what was added and what still remains. Because it does feel like it fits a little bit more what we were just discussing. Any thoughts after Mara redirected us to the rest of that sentence? Does it fit the concern and the need?
This is Jude. I actually would say low barrier. So, harm reduction interventions are low barrier. And we can create a lot of barriers for people to access interventions. And then I think accountable. And I don't know if we can use the word equity, but accountable to equity specific performance measures. Because I think, we can say without judgment, stigma, racism, or discrimination, but unless we're measuring what it looks like without those, looking at equitable access for people that are currently using substances.
Thank you, Jude. Go ahead, Blue.
I'm just wondering if, in that last sentence that's at the bottom of the screen, if we could maybe add without coercion to that. I don't know how folks feel, but that's just my thought.
I also see that Jenna wrote something in the chat. Health and Safety Committee operates on a shared belief that respecting the rights of people who use drugs is critical to providing the best services to those that access them, or something similar. Those are great.
My thought is, since we so first, Mara, thank you for pulling this all together and making it as clear as possible for us and having lots of opportunities for us to weigh in before this meeting. So thank you very much, and appreciate everybody who did weigh in. And I really appreciate the time we're taking now to also offer our suggestions. And I'm thinking we should probably not move forward with a vote because there's been quite a few requests. So maybe we should pause and take the feedback that we heard and try to make sure that we got it right and send it back out to this group before the next meeting. And we can vote at the April meeting. Does that sound okay?
I'm seeing a lot of nods. I love that. Before we go back, like after this, is there anything, any other like things of substance that, other than like, wordsmithing this, that anyone would like to have input on? How do we, like, does anyone feel negatively about co-chairs, or the putting in the language about attendance? Like, do any of those things need wordsmithing or changing, or is it this paragraph just going to be the wordsmithing, the piece that we do after this?
Okay. Just the paragraph. Okay, great. So Mara, do you feel like you had lots of really, oh, Eric, your hand is up. Go ahead.
Oh, I was just wondering, so who all is going to be reading our, kind of bylaws? That'd be my question. Like, just because if we're gonna get so far into the weeds about the political what could happen if this is read, like who all has access to this, is just be my question.
Yeah, this is posted on our website. So
Okay.
this is available to anybody who would like to read it. This is a public meeting, so all of our materials included in decision making are public materials. So anybody can read this if they so choose.
Mara, do you have any like other questions to help us move forward with that paragraph, or do you feel like you?
No, I think there's been some good suggestions, and there are some notes that have been taken about suggestions, and so I will go through and try and come up with some different language.
If I can just make a point of order, if voting members could send to Mara specific language or issues, again, do not want. Thank you so much to our agency partners. But I think it's really important that the voting members of the committee get this to a place where you all can move it forward. I think if folks could just really focus if there is something particular and if you could work that through with Mara beforehand, because this has been put out. I think to Eric's point, like, yeah, people are going to see it, but this isn't the be all end all. And, so probably want to move on.
Yes. That was somewhat of what I was going to suggest. So if you are a voting member and you had concerns about this, and Mara, I think you're probably tracking who that is, we'll connect with you in the next week or so to make sure that the language makes sense to that group, so that we can move forward at the next meeting. So I agree, Annalise. Thank you. Anything else before we move to the next part of our meeting? Okay, Mara, thank you so much. And thank you to everyone for your feedback and suggestions. We
Can I
are
add
now,
one thing, Stacy?
oh, of course, yeah.
I'm so
Yep.
sorry. Um,
No.
so in true doing things by committee fashion, we had like a pretty split vote on if we wanted to move the committee meeting to um, the last Tuesday versus the fourth Tuesday. So I would love if we could try and get ourselves to a decision point on that very briefly. For context, this meeting has traditionally occurred on the fourth Tuesday of the month from 9:30 to 11. This month, we moved it to the last Tuesday of the month because last week was spring break for most folks. And I put out a poll asking, would we like this to be a one-time change? So we just go back to being the fourth Tuesday after this, or would we like to make a continued change, which was change this to the last Tuesday of the month. And I took notes on this. This affects, for the rest of the year, this affects, June, September, and December. So it would usually be the fourth Tuesday. There's not always a fifth Tuesday. Does anybody feel strongly about keeping it the fourth Tuesday? Because there was a slight tilt to the continued movement. Eric.
So I feel strongly about having it moved to the last Tuesday of the month because I have staff meeting. I just moved one of our pretty major staff meetings to Tuesday at 10 o'clock. So then I wouldn't be able to come all those weeks. That would be the fourth Tuesday if there was 5 Tuesdays that month.
Okay.
Which is selfish, but I'm letting you guys know.
No, that makes sense. That's helpful.
We're asking, so that's great.
Yeah. Yes, and as I am seeing, the uh, June date is June 30th, which is the week of 4th of July. The December date is December 29th or 30th, which is the week of, but the week before that is also Christmas. So, those are times that we're oftentimes shifting things around or finding other ways to engage with each other anyway. I see no difference. I see I will go with the majority. I see I am with Eric. So what I'm hearing here, Crescency, I saw you unmute.
Doesn't matter to me just because I think that I think I voted for it to stay, but it doesn't really. I think my schedule is fine for it to be switched to the last Tuesday.
Amazing. I'm loving this. This is fantastic. So I am going to therefore make a change. So we are now the last Tuesday of the month. Does that work? Yes, Stacy?
Works from, yes, absolutely.
Amazing. Yay. I love it when we make decisions together. This is my favorite part. Okay, cool. So that has been changed. I will get that all written up and changed in all of the 75 million places that it is written. And we will meet. It'll be the same for us until June, 4th Tuesday of the month. And then the 5th Tuesday will start in June.
Okay, great.
Yay.
So just to recap this last portion, thank you, Mara, for your unending patience. Really appreciate it. Mara's going to go back and do some word smithing to make sure that we have the right content for that last paragraph around social justice, and that we've all just agreed to move to the last Tuesday of the month moving forward. So just recapping that part, thank you very much for everyone's input. And I think now maybe we can move to the naloxone part. Mara, do you feel like? Okay, great, awesome. So we'll have some slides that are going to come up. But just a quick, our goal for the rest of our time today together, except for public comment at the end, is to have a preview of our naloxone work over the next couple of months. Oh, we don't have any more slides. I thought we had slides for naloxone. Okay, God, sorry. We are not having any more slides. We get to just talk as a group. I apologize. I was out last week, so I feel a little bit disjointed. Thanks for your patience. Okay, so let me just reorient. If you remember, Mara put together a really lovely overview of the year, and it was of our work plan and what we were going to be focusing on each month. And we had hoped to dive into naloxone in April. There was a lot of feedback around we might need more time for naloxone since it's such a big topic. So we wanted to take some time today to think through that preview. And I'll hand it over to Mara to just give us a little bit more context for the discussion. That would be actually very helpful. And then we'll go from there.
Awesome. So there are some new faces here, so I'm just going to very briefly go through what we are talking about. This is our comprehensive plan that the ADPC as a whole put together. All of our committees put forth strategies for our 5-year comprehensive plan, the terms of which began in January and go through 2030. And we, as the Health and Safety Interventions Committee, put forward a few strategies. The first, and what I have heard from the committee, from the voting members in this process, the most important of which is our naloxone strategy. And one of our members, who is not here right now, unfortunately, put it in a very eloquent way that I have been quoting in my little elevator pitch for this the entire time that we've done this, which is demystifying the naloxone acquisition process. I love all of those consonants together in that way. And So when I sat down with Annalise, we had this conversation about what does this look like, and what are we prioritizing? How is it moving forward? We have this like hundreds and hundreds of lines smart sheet that for all of the committees that list out all of these strategies. And for this one, my vision, based on all of the input that we have had together, is I want um, every single person in the state of Oregon to know where to get naloxone and how to use it. From top to bottom, from left to right, are you eligible for Save Lives Oregon? Should you be buying through MCAP, the multi-state purchasing agreement? Should you be buying through, should you go to a pharmacy? How, and then how are we training people to use it, etc. So from top to bottom, left to right, every single person and agency and entity should know how and where to acquire naloxone. So starting there, we are starting with our 14 agency partners. And there are, as Annalise mentioned, we are doing a financial analysis, which is where we're going to all of our agency partners and asking them to look back on the biennium of 23 to 25 and asking them to explain some of their spending to us. And we took naloxone out of treatment, recovery, harm reduction, prevention, anything that people have listed naloxone, we've asked them to take it out of their level of continuum of care and to like specifically talk to us about their naloxone spending. So that is going to be really awesome, and we're hopefully going to be able to have a preview of that information. I would like to say next meeting, but it's probably more likely May or June that we will have like a solidified answer about that. So that is one thing that will be coming to you to give you a little bit more context. Yeah.
Quick question from Serafina. Are we asking about spending and usage for those agencies?
Yes. It's been broken down into a couple of different things. Staffing and supplies. What we're hoping is this is like the agencies, like at the agency level, rather than like the grantee level of like who they distribute, like if it's like individually distributed to those people. And so we're thinking, my thought process is that it will be like we give this money to these people for purchase of naloxone. Annalise, does that make sense? Am I saying the wrong thing?
No, I mean, I think the financial assessment it's about spending. I think the conversation you're about to have is those questions when, like, when we go deeper with the agencies, my hunch is you all want to know, like, how are you tracking that? What is the distribution, et cetera?
Yeah.
That's what you get to determine.
Yes. So that's a really good segue. So thank you, Serafina, and thank you, Annalise, for clarifying, because this is the point where when we're talking about naloxone preview, when we're talking about this is like, what do you want to know? This conversation is like, what do you need to know? What do you want to know? Like right now we're talking at the agency level. And then after this, we will decide who comes next. Is it, local public health authorities? Is it CBOs? Is it whoever comes next after this year? But right now at the agency level, what do you want to know about naloxone spending, purchasing in this grand scheme of things? What are we asking so that we can tailor these meetings to really like bring you the correct information that you need and want to know in order to make decisions about, moving this process forward. And I am going to take some notes. I know Ashley is also taking notes, but I'm going to take some notes. So, Stacy, are you able to?
Yep.
Thank you.
I see Blue has your hand up.
Yeah, I know you said this already, but like it did not fully register in my brain. So can you just tell me again who the agencies are that you're asking?
Yes. So
Thank
we
you.
have, I can find it and I will put it in the chat. We have 14 partner agencies that have been specified by the legislature. So when the ADPC was developed by the legislature, they said, ADPC, you need to exist. Here's the 14 agencies that we think that you need to work with. It includes agencies such as OHA. So we're working with different divisions within OHA. OHA, Oregon Department of Human Services, ODHS, the Veterans Administration, uh,
It's in
Housing.
the chat now.
Yay. Okay, thank
If
you.
that's, yeah. So I put in a little bit of like the
Yep.
higher level goal, which is the like trying to demystify this acquisition process. So what do we want to know about naloxone spending, usage, acquisition barriers, etc., from those following agencies that are in the chat? So you can take a look here. There's 14 or 15. Oh, there's more. But
There's
is this all of them?
14, I think, primary, and then the additional two are just other, Oregon-based entities that we look to, like nonprofits and things like that. Any state
And
agency that administers
yep.
funds for substance use prevention.
Or
Thank you.
some people that aren't included in this, like we talk to HIDA a lot, the high intensity drug trafficking area. We talk to ODOT sometimes. We talk to like there's other agencies that like touch this. So thank you, Serafina. The 15 and 16 really help.
Yeah, that was from what you gave me last time. So it's my pleasure to share it out and continue to share the knowledge that you provided me. But my big concern and one thing I've seen with naloxone, and I feel kind of sad that Haven's not here because she has been such an advocate for this work. And I just feel like she's got so much to add to this. But what I do want to bring up, and one thing that we've seen in our, naloxone specializing training and really getting it out into our communities is that even when state agencies, whether it be a police department or a fire department or a community-based agency, are able to get naloxone, what we'll see sometimes is that it gets put in a back room and forgotten about because they don't know how to get it out into the community. They don't understand how to properly use it. And so I think that's a big thing that I want to bring to the table in these discussions is asking not only like usage, but how are they following through with getting it into the hands of those that need it most? What are those methods? And how do they see training through other organizations to do that for them if they're not able to do so themselves?
Yeah, in some ways it's like that logistical workflow. Do they even have workflows in terms of how to get it from agency to community? Go ahead, Blue.
And I don't know, like officially, um, what stance can be taken on this, but I will share that recently, one of our community partners asked what we did with expired naloxone, and they shared that they had around 3,000 doses that were expired. And then they didn't know what to do with them because they didn't have a policy for distributing it. And we know that expired naloxone still works. When our program started, all we had access to was donated expired naloxone. Um, so I'm just wondering if there should be a question around if you do have some that hits expiration, what is done with it? And I'm wondering if maybe we can figure out a pipeline to get those redistributed, whether it's through nonprofits because maybe there's limits around public health or state agencies, but wanting to make sure that that is not just thrown away.
Thanks, Blue. And then another question from Jenna, is there anything we can do about these arbitrary early expiration dates? So maybe like legal guidance on what to do about the expiration date.
Yeah, and there's a lot of studies that have been published now that never existed before that show how resilient naloxone is, how effective they are after expiration. So kind of bringing some of those surveys and information we have to date to the forefront and sharing those out to educate the public.
Eric, go ahead. You're on mute. Bella, we still can't hear you, but I did see you come off mute. Let's try again. Here, we'll let you figure that. We'll work on that while Naomi shares, then we'll come back to you. Go ahead, Naomi.
Thanks, Stacy. I mean, I have so many thoughts, so I'll just say that up front about things that we can learn. But I have a clarifying question as well. Is this asking kind of these larger bodies to then, I guess, reach out to other folks and ask for feedback? Because I'm just thinking there could be a lot of crossover with the information that we have that we're receiving. So I'm wondering, for example, are we asking OYA to report to us how much naloxone is getting distributed? And can you clarify that for me?
Yeah, absolutely. Right now in this bridge period, within the financial analysis, we're just asking like the spending. But I have another spreadsheet that is basically like who is purchasing naloxone within these agencies, because some of them say like, oh no, we're not purchasing it. I'm not purchasing naloxone. So then the next step would be, as using our connections within and our relationships within these agencies that we continue to work with. I would go to them and I would say like, hey, you guys said you didn't purchase any naloxone. You're our partner in this. Would you like to begin purchasing naloxone? And we can provide you technical assistance in getting you connected with who you like, how you purchase naloxone. To I think it was Serafina's point, some like model policies. If you would like to distribute naloxone, this group we can, come up with whether there's things that already exist that we want to put our recommendation behind, papers, white papers, or model policies, or any kind of recommendations on trainings or distribution guidance or whatever that everyone is already using, everyone is already utilizing. If there's like one or a couple that we want to put together, like a suite of recommendations that we say like, okay, the ADPC says if you would like to purchase naloxone and distribute it, here is guidance on here's technical assistance on how to purchase naloxone. Here is guidance on best practice for distribution. Here is a training video that can be utilized for this, or here is a train the trainer opportunity, or here is all of these different things, and then we can help you in this process so that this is streamlined and we are the ones who get to make those recommendations, is really what this is. Does that help, Naomi?
Absolutely. Thank you, Mara. I think then it might be helpful for you to hear from us. It sounds like just anything that we would like to know, and then we can kind of solve it from there. I have lots of thoughts, like I said, so I'm happy to put them in the chat too. But I just wanted to maybe highlight, Jenna had mentioned something in the chat too, about just the challenge if we're asking just about spending. And so I wanted to jump onto that too. I think it's really important that we not just ask how much people are spending, because also it depends where they're purchasing from, what type they're having. So whatever information we can have, like the type of naloxone they're purchasing, if they're getting a single or if they're getting a kit, how much money, the number that actually is, all of those things would be really beneficial. I realize that it's not going to be the same across every different program that we talk to, but for us, that's been really beneficial for making sure really what the need is, even knowing if they're administering it or distributing it, what populations they're primarily giving it to. So is it criminal justice involved folks or not? And then the type of group that they are too. So if they're youth serving, if they're working with the burn. So I think any of those specifiers have really helped us. And then I'll just say one last thing. I would say also asking them who they're partnering with also might help us reduce redundancies, because we have a lot of folks, or in like Washington County, for example, where we have maybe 4 or 5 partners that are working together to distribute the same funding. So if you went and asked like our corrections team and our sheriff's office, or behavioral health or our providers, they could very well be reporting the same numbers 4 times. So I would want to make sure of that. And I know I said that was the last thing I was going to say, but just a side note, we are starting to see that even though there was a decrease in the amount of naloxone that was asked from the community, we're starting to see like a 20 to 40% increase in need. So I don't know if other folks are seeing that as well, but if anybody else is tracking trends over time with spending numbers, anything else, I think that could also be beneficial because then as a state, we can see what the kind of supply and demand challenges may be going forward. So I'll put some things in the chat. Feel free to ignore any of them, but just to kind of help gather my thoughts as suggestions. Thanks.
Thanks, Naomi. And there was lots of emoji reactions and comments in the chat, so I think there's lots of agreement with what you just shared. And then there's some train the trainer encouragement. Jenna, do you want to? I know you wrote it in the chat, but do you want to share a little bit?
Yeah, sorry, my voice is a little bit funny right now. But
Do you want me to read it? Do you want me to read it instead?
No, that's okay. I was just saying, I think, there are a few folks out in the community that have offered themselves as trainers to train other trainers, and I don't think very many people take us up on that opportunity. And I wonder if there's just a formal way that we could go about doing that so that people feel a little bit more confident in what they're being given, that it's backed, that it's supported, that it's not sort of like I'm claiming to be something that no one is validating, right? But it's such a simple training, and I think getting more people comfortable with doing it is super important. And so formalizing that process in any capacity, I think could really help with that. And I was just going to respond to Naomi also. I think that, when we see a large increase in need and orders, it's probably because people are coming up against, that big batch that we got that we didn't get out in time has now hit that stupid expiry date and we can't give it out. So we have to get more. And I'm hoping that other agencies are sort of secretly like moving it out the door to the community without logging it in such a way, because it is still super effective. And there do need to be more places that can take expired naloxone and use it and not just for training, material.
Jenna. Naomi, is your hand up again, or did you? Either is fine. Just wanted to make sure.
Sorry.
No, that's good.
I came off mute. Can you guys hear me now?
Yes, go ahead, Eric.
Okay.
Thanks.
So we had a really powerful trainer come out from Project Red at the Portland Alano Club, and she incorporated something that was different than any other naloxone training that I've heard. She would announce, to the person, "I'm about to give you naloxone," which I just thought was genius, because so many times people will just, "Oh, that person must be dead. Let's give them the naloxone," But the other part of that I wanted to say is that gosh, giving naloxone out to our communities is actually a skill that's actually not that easy to do. People don't want it, like even when I've worked at like the syringe exchange, people don't want to take it because they feel like it's never going to happen to them. And there's almost like a skill involved in that. Like, I mean, it'd be interesting to like create or implement some sort of training for actually giving it away, especially to like family members who aren't, don't have substance abuse problems. Maybe trainings for like doctor's offices where people are going to come in and maybe they, the person doesn't identify with any kind of addiction at all, but they're on opiate, or benzodiazepine type medications, and overdose could actually happen. I know one of the strategies I've used over the years is I always just like remind them that it's not for them, like, "Oh no, this is for your friends. Like, I understand that this would never happen to you or whatever, but there is like a skill to give it away. It's kind of hard to give away, really. I mean, we can leave it in the lobby and sometimes people will take it, but even like street outreach, it can be hard to give away, even when we're in like the camps where people are actively, suffering with there was like an overdose yesterday, and but they still don't want to take it for some reason. So that's just kind of some thoughts on that.
Yeah, that's super helpful. there's a lot of agreement around generally the idea of training, like how to actually administer it. Also some requests around dispelling like the risk of giving naloxone to someone. Um, anyone else?
I think we'd be remiss if we didn't bring up the connection to pharmacies and the lack of pharmacies here in Oregon and stigma that still exists around naloxone. I think we've definitely seen strides in that area, but we still have a lot of work to do.
Yeah,
And then
by the
Eric,
prescription, but
just kind of
sorry.
highlighting what you said. I mean, we know that even people who are actively using drugs have had a lot of trauma around naloxone. And there's all sorts of different reasons why people refuse to take it. But what I do know is a lot of people are tired of saving people that they've saved many times before within these settings, right? So we like to think of naloxone as any other piece of your first aid kit, and really try and come up with creative ways of getting people to have it on them and to carry it.
Thank you. Anything else? Mara, looking at the notes, do you have any like clarifying questions to help you with the next steps?
No, I think this is really awesome. I think next month will be, the entirety of the meeting. I'll try and get some folks to come and speak to this, and we'll start on some of the potential documents, I think, that will help move some of this forward. I think we can uh, rank, I guess is the right word. Rank like what's the most important place for us to start, and we'll get in there with some of these documents, recommendations, and what we can sort of uh, look at what the next year is going to look like in terms of this strategy. Naomi.
Yeah, thank you. I just wanted to mention, I put in the chat a presentation that CoImagine and OHA worked on a project, I feel like a couple years ago now, but where they updated some of the things that folks were talking about, some everything from where to get training, how to talk to folks about accepting naloxone. So I just wanted to have that as a resource, but also just as like I guess a caution for redundancy. There's been some really amazing people that have done some great work that I think we could piggyback off of and use.
That's great. And potentially that's part of the process, right? Like if we if tier out what we think are the most important areas, the next step would be making sure that we are aware of all the current resources that exist to highlight work that's already been done, maybe. Great. Before we move on to public comment, Mara, and Ashley, are there any other questions you have after taking notes? Want to make sure you have what you need.
No, I am great. This is a lot of fantastic information. And this is exactly, Naomi, this is exactly the kinds of things that I am looking for. So if there are things that you use in your day to day, there are documents, there's training videos, there is whatever is your, holy grail of this is how we train or distribute, or if you have model policies, if you have whatever it is that you have that you're using, send them my way, please. Put them in an email, send them my way. I am so happy to have them because this is um, when we go to make recommendations, like I can only look up so many things. Like I need that this input is exactly what I need. So thank you. That's fantastic.
That's great. We're definitely not going to recreate anything if it doesn't already exist. So, okay. If you have more thoughts after this meeting, you can always email and Mara and I and whomever share your resources with Mara. But I think we have gotten what we need for that portion of the agenda, and we can move to public comment.
I have not received any written public comment. One of our listeners, Kirsten, just reached out to mention that it's helpful to hear the conversation and the work of this ADPC subcommittee, and it's great stuff and so important, and she's grateful for the opportunity to listen in.
Thank you. Anything else related to public comment? Okay, and Serafina put an update to Max's mission in the chat. Thank you for doing that. That's great. Is there anything you want to say out loud? Okay.
Just if we want to alter that, Naomi, I'm happy to work with you, whoever I need to make sure we get the most up-to-date information out there.
Okay. Then I think we can adjourn for today. Again, thank you to everyone for letting us meet in March. This was great. This is an incredibly helpful meeting. I know we got lots of information to move forward. I feel confident that we'll be able to complete our bylaws at the next meeting. So there's lots of gratitude for making this happen this month. It's very helpful. And our next meeting is April 28th. Slides will come out after today. Communicate with Mara if you're a voting member and you have questions or concerns about that paragraph around the social justice. We look forward to diving in more deeply to this conversation in April. It feels funny saying that since it's tomorrow, the end of April. We'll see you then.